So where do we collect the real data? Of course, our company is Gemba, so we go to Gemba to collect data. We don't like to sit around conference rooms and decide from people who are experienced, because it's a very distorted or perceptive view of what the situation is. We don't like to entertain that kind of variation, so we go to Gemba. We actually go to where work is happening, see for ourselves, because there's always things that we see that we didn't realize actually exist. So how do we do that? Well, we actually go to Gemba. So the first thing we want to do is understand the current state. So in this picture, we actually took a team down to the emergency room to see what was happening, how the process worked and the process flow. So we would ask questions. Now, one of the things we've also learned in healthcare is that you can't just go walking around the hospital without asking permission to go into certain areas. That's one. And two, we don't want to interfere with the flow of the patients being cared for in the first place, right? So we don't want to intrude upon the privacy and dignity of patients in the hospital, nor disrupt the flow of the process that's going on. So we're really careful in announcing and suggesting when we'd like to come. And if it wasn't a good time, we'd come back. But we always try to find a good time to look at the process and be able to ask the questions by the providers. We'd follow the pathway. Just like what we did with the patient flow, we would actually follow the pathway. And in this particular instance, the pathway was told to go this way, and what we found is that the elevator was out of order. So how many times have our pathways stopped and we didn't know it? And of course, the charge nurse at the time didn't even know it herself, that was the problem. So now what is the flow? It went halfway around the hospital as a result of this one elevator being out. So we learn certain things that happen. And then we ask questions now, well, how often is that elevator down? What were some of the reasons? What can we do to prevent that process of being delayed? And then we take measuring wheels and we actually measure the path. So how many people have taken measuring wheels and went through and measured paths through the process? Several, okay? We've done it by taking steps. We have done it with measuring wheels. We found measuring wheels to be the most accurate process, so I recommend that. And then we went everywhere. We went through the OR, through supplies, we gowned up, and we actually just went through the whole process. Because we want to capture where all these paths are. So we walked and walked and walked and walked. And processes, it was interesting when people were going through it. Oh, that'll take us 15 minutes to walk it, and it takes us 55 minutes. So whatever you think it's going to take to walk, double or triple it. It's going to take that long to go through the process. And then you map the process is another good way. We just like using butcher paper up on the wall and Post-it notes and really measure what that path is and show where all the processes are. So basically this is your process flow here and all the things that go into it with our different flows. So what we'll have here, where wait times are by different colors, where some of the supplies come in, where's the information flow. So all that is posted up, and this happens to be a pediatric example. And then you collect the real data, and that means going out to the floor and doing spaghetti diagrams where we actually measure a nurse path back and forth, and that nurse is back, pretty heavy and busy walking around, wouldn't you think? So we can see that. We actually measured. One of the things that we noticed is that there are a lot of things in the hallways. So one of the things is that we want to design a hospital where there's nothing cluttered in the hallways. So we actually went out and measured what was in all the hallways and how much space that was. And one of the thoughts that we have, and we'll talk about that later, is we design a hospital based on this is the standard amount of space you should need. Now, does that match with the amount of space you really need or the amount of space you really are taking up? Because it was amazing where we found just where things were stored at. And I'll show you some cool pictures of storage solutions. And then we measured everything. Another thing we like to do is look at adjacencies. When you go through the process to collect data, what should be next to each other? And it was really hard for people to conceptualize where things should be close to each other without having to think, this is how my current design is in my hospital or my clinic. So to try to step back from that, we said, well, make a Post-it note for each of the basic paths or function areas. In this case, we have labor and delivery, we have postpartum, we have NICU, we have PICU, we have antepartum here. So we put the different function areas here, just put them on Post-it notes, and then so let's just draw lines between them, where they're connected, and where is it critical that you need to be connected, where is it more frequent that you need it. And through that, we can tell that what needs to be next to each other, and from this type of diagram, then we can look at the hospital layout and say, are they located next to each other, and where can we optimize those locations? We even found an example where a mother gave birth, and she was still a patient in the hospital, but then her newly born baby had to go to intensive care, different floors down the hall. So she had to walk long distances many times a day just to go see her new baby. And we found situations like that aren't acceptable. We want to move those things closer together. How can we solve that situation so a mother doesn't have to walk a long distance, especially just at giving birth, to see her baby? Once you have got all this data, the next step is to develop 7 alternatives. This is probably the hardest step in 3P, because a lot of times we are good at collecting data, and we say, all right, let's come up with solutions. And as engineers and as lean improvement agents, we can look at a process and say, well, we should do this, this, and this. Or this is one good design. So how many of us will go with our first or second design idea and say, this is the solution? And if it improves it, that's good enough, or go forward. 3P is a little different. This is the biggest challenge of 3P. We asked you to come up with 7 distinctly good alternatives to do a design. Most people can come up 2 or 3, but when you get past 4, 5, 6, 7, really people struggle. This is the hardest part. But it's specifically set at 7 because we want to challenge our thinking. Because what happens is the first 1 or 2 or 3 ideas usually are the easier ideas, and they're very similar to the current design. Well, when we get down to 5, 6, and 7, now you're really thinking beyond your normal design ideas, and all of a sudden now you're coming up with ideas you never thought of before. What if we did this? So that's why we ask for 7. Now these aren't just 7 ideas, these are 7 ideas that could work. Okay? So again, this is the biggest challenge. This is where we spend most of our time coaching, is to come up with 7 good ideas. Now what you want to do is that they're all good workable ideas. Find out what it takes to work, and you don't want to evaluate these ideas at this point. Just get them established and then focus on what might work. Consider all those process steps. Don't worry about equipment. And then don't rely on the older in-house processes. Select what is best. So 7 alternatives. That's what we want to come up with. When we start looking at these alternatives, we talked about being patient-centered. And I've heard that here from several people, that how can we set the hospital up so it's patient-centered? So we don't have examples of the patient going through a public area. That's not very patient-centered. So how can we improve that? We want to be very efficient. We want to minimize any waste in the process, any duplication. That's where the understanding of the 7 wastes come in. We certainly want to look at our processes, know what 7 wastes are, and try to eliminate them in our processes up front. So we do a lot of mapping of the processes and improvement. Have a safe system. We certainly want a system that will eliminate the possibility of errors. And if you looked at some of your metrics, how many hospital-induced infections are created in your hospital? Okay, are they preventable? If they're preventable, why aren't we preventing them? And then you ask the questions of why and go through the process of saying, we want a safe hospital. We want 0 hospital-induced infections. How do we do that? And that's how do we have a design that helps us do that? We want an effective hospital. Here's an example of a hospital room design that basically has the hand washing sink out in the open, so it helps encourage hand washing, which we know is very important for infection control. Unlike Kent's example that he showed earlier, here the actual bathroom has a large door where you can exit in or enter in at the head end of the bed, so it's very easy to walk to. You didn't have to walk across the room, so it was closer. They also have a handrail right here to assist, and then the door coming out here, the nurse can see very well the patient, and so it's visual. So things you want to do is very effective designs. Where does it make sense? And you want to test some of these theories out. Timely, no unnecessary waiting. Do we want to have waiting rooms? Do we want to have waiting rooms, but don't call them waiting rooms, just say that they're comfort rooms or they're other names? Are there other creative names that we have for waiting rooms? Do you use anything besides waiting rooms? Family rooms, okay? This is not an exercise of renaming it, so we don't have to call it a waiting room. Because if people are still waiting, it's still a waiting room, okay? So how can we have unnecessary waits stopped? I mean, can we make sure that we don't have systems where we put in where people have to wait? Reduce steps. That was one of the major things that we looked at. And the way we looked at it is, how can you look at the process, like the patient flow, and how can you cut the number of steps or the distance by 50%? Not 10, not 20, but 50%. We want to go in there and cut it in half. That's what we presented to the teams, and they did a very good job of doing that. So when you go through a 3P process, don't look for small incremental improvements. Say we want to cut that distance in half. Because if we do enough walking as it is, let's make the process where you don't have to do this walking.